Right, got a few interesting different cases here today. Now, first one is it's a lower denture, and as you see, this lady still has most of her teeth at the bottom of the front. And so the conundrum with dentures on the bottom is always the connector that goes behind the teeth. And when patients get a big chunky piece of plastic here, they always hate it and they become a pocket denture. And they'll go, yes, I'll wear it, and then they don't. But if the teeth are healthy enough and it's the correct case, we can actually create a titanium frame. Now this is a milled titanium frame, but then it's also been anodized. So it turns gold, so it looks absolutely beautiful, like jewellery for the mouth. And there is scientific studies that say that it's biocompatible when it's been anodized. And also the tissue has been composite wrapped, so it's latest generation of natural tissue. So as you can see, that's how it looks there. And then when you pop this into place, click, almost like it's been implant retained, because it's created with a guided path utilizing the undercuts, so it goes, clicks into place. And then crucially, behind the teeth, it leaves the margins of the teeth nice and free, so your tongue can get in and actually self-cleanse everything. It's not going to create any food traps for bacteria. So, but you'll still take this out every night and give it a clean, but then it's also got support where it's using the teeth for support, so it's not tissue borne, it's not just going to press into the tissue. You've got rest seats there which are using the strength of the teeth to support the appliance. And then you'll see from the front, when the lip is there, these clasps are practically invisible, and all you'll see is this, you'll just see this nicely restored space. And there's a nice clip at the back, it's nice and strong. So that's going to be an interesting one, I'm going to fit that next week. This case is, again, very different. This is Fanaris 2 uniform colour with composite tissue. This is the ultimate denture you can have, apart from when you start adding fake amalgam fillings and detailing, etc. But yeah, this is probably my most successful range. And the level of work that goes into these is quite phenomenal. If I had to make dentures for myself, I would certainly use Fanaris 2 teeth because they're phenomenal. If I take them in, if you can zoom in on them, let's move them, I can just see the level of detail. All this is built up in light curing stain composite acrylic. So you can see it's got purples and whites and reds and blanching over where the natural root eminence would be for the canines. And just where there's like extensive blood vessels up the border of the gingiva, you can see there's purples and reds and muscle attachments. And you can just see these teeth are absolutely stunning. And this is actually fairly dry, it's not wet, so it will glitter even more when it's in the mouth. A real piece of art, very, very different to the dentures of old that Granny used to keep in a glass. These are absolutely phenomenal. When you see these in the mouth, they just pop. You would never know they were dentures, they're just stunning. Again, this next case is a framework case. Now there's not any teeth on this yet, but this is how it starts. Now this lady has lost all her teeth at this side, lost a tooth at the back. She wasn't suitable for implants, so we've ended up making her a milled titanium frame. So I'm going to take this frame off. You'll see this is what she has. She's got a bridge there, you can see up in the back there. So there's what she has. So that's what you see from the front. So we aim to restore these spaces. And these are as light as a feather. You can see this one has been designed, so it's not going to interfere with any of our bridge work. So you see, again, keeping all the margins clear, using teeth for support. She's got a really tight bite, so we couldn't apply any rest seats. So, but this one, she's got a nice palatal strap that'll keep that, because you've got a nice ridge, torus palatinus, which goes right up the centre, and that will just sit nice and tight on there, and it'll go click, and then we'll bond the teeth on there and there. And it'll be a nice healthy design that's going to keep these teeth healthy for years to come. So, and then there's this one. This one's an interesting one. This patient was really worried about the thickness of the palate, and she needed a bit of strength, and she only had 2 teeth left. So she had a 6 here and a 7 here, and so from the front, so We created a titanium palette, which we then anodized gold, and then it's composite tissue, and these are for Nara's 2 teeth. You can just see all the different colours of the tissue. And yeah, that's an absolute beauty. So yeah, there's lots of people quite often call the practice and they'll say, how much for teeth? That's a bit like saying how much for a house or how much for a car, because there are so many different variations of denture. If there was just one type, I could answer that, but there's so many different. What you need to do is book a consultation. A consultation is only £50, and I only charge the £50 if the patient goes away to think about it. If they come back and continue to treatment, I take the £50 off. So effectively, it's a free consultation. So knowledge is power. Come in, find out what can be done, because I can't help you unless you walk through the door. That's the thing, and that's the most difficult thing for a patient. Years of phobia, years of anxiety. Make the call, come in, have a chat. I'm an ordinary guy, but I do extraordinary work.